Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Ann K. Lagarbo, Chief Medical Officer for United Healthcare Community Plan of Louisiana, and I'm filling in today for Dr. Penny Walker. Thank you for joining us. Today on Community Health Heroes, we'll be talking with Charlotte Parent, Health Director for the City of New Orleans, who will give us an in-depth update on the city's health, and Phil Degree, owner of Phil's Grill, who will prepare a nutritious and delicious bison burger on today's Eat Fit NOLA cooking segment. And he'll share some tips for preparing a healthier, tastier burger. So don't go away, we'll be right back with more Community Health Heroes.
Storms come up fast. Take time for storm protection now. Reinforce your roof. Make sure you're adequately insured. Shutter windows and other openings. Elevate your home if you live in a low-lying area. To learn more about how you can protect your family and property from storms, visit getagameplan.org and click on Mitigation Plan. Louisiana, we can do this. This mitigation message brought to you by the Governor's Office of Homeland Security and Emergency Preparedness.
Quiet, please. Wait a sec. I'll take one. Oh yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh no. Please, please, please. I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
Having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
This song was created with heartbeats of children in need. Find out how it can help frontline health workers bring hope to millions of children at everybeatmatters.org.
Welcome back to Community Health Heroes. The people of New Orleans face many challenges, and we celebrate many successes on a daily basis in our city. Here to give us an update on the physical, mental, and emotional health of our city is Charlotte Parent, Health Director for the City of New Orleans. Thank you for joining us, Charlotte, and being with us on this segment. How are you?
I'm great. Thank you for having me.
Excellent. So, hurricane season kicked off on June the 1st.
Yes.
And we know that this year is the 10th anniversary of Katrina.
Yes.
Is the city prepared for another hurricane season?
Yeah, the city is prepared. You know, one of the big things for us is we now prepare for hurricanes year-round. We are not just looking that the date is June 1st and let's talk to everyone about whether or not they had their plans in place and those sort of things. One of the lessons learned from Katrina was that preparedness is not a single event, and that it's just part of life down here in Louisiana that we need to do those things. So all year long we're contacting in particular our citizens who have medical special needs to make sure that they have plans, or if they don't have plans and understand how to evacuate, that the city knows who they are, where they are, and what those needs are. And we do that continuously year-round. And I think we are in some of our best prepared state in terms of the health department and the city at large to make sure that our citizens are taken care of.
That's fabulous. That's reassuring.
Yes.
That's wonderful. Let's talk about access to mental health. That has been in the headlines recently. The city, how are we addressing the mental health access issues?
Sure. So, you know, for years we've talked about the fact that we've lost mental health beds on the inpatient side. And while the city doesn't really control, you know, how many beds are here and that sort of thing, what we have tried to focus some of our attention on is making sure that citizens and the care coordinators are aware of what is available, not only on the inpatient side, but even more so on the outpatient side. So we work really closely with Metropolitan Human Service District to make sure, and they are our partners in terms of making sure that in Orleans, Plaquemines, and forgot one other parish, that the mental health resources are coordinated and available. And we have set up through the City Health Department a behavioral health council that really came out of this conversation that we don't have enough. And, you know, what are we doing? We don't have enough. And we brought all the partners to the table to make sure that everyone knew what was available and that they were talking to each other about how to use that. And we publish every month a mental health dashboard that tells what the usage is and what the capacity is for those things. It's available on the city's website so that people can see what's going on from our point of view at this point with the data for mental health. And, you know, we can always use more beds. That's not the issue, but we want to make sure that what we do have, we're utilizing.
That's wonderful. Very good progress. So the smoking ban has been enacted.
Yes.
How do you think that's going to affect the number of smokers that we have? Will we be seeing increases in people who are ready to quit the habit?
I hope so. I hope so. I think what we have found, and when the ban was, we were working through bringing the ban in place and working with the public health institutes and Tobacco-Free Living Group and Smoke-Free NOLA. The data around the country from people who have gone smoke-free showed that when you began this, the work of this, public health education was extremely important to make it work, and that you should spend the beginnings of your time making sure that people understood what they could not do, giving them the information on why smoking is, you know, a public health problem, in particular secondhand smoke, and building into our campaign the ability for people who want to quit smoking to be able to access that. So if again you go to our website, Smoke-Free NOLA, not only are you going to find out information about the ordinance and, you know, how to get your signage and things like that, you're going to find all the resources that are available to help you quit smoking if you're ready to do that. And when we went out to the bars to make sure that everyone understood that, we made sure that they had that information. So if people who were there wanted to have the information available, it was readily available for them. So I'm hoping that, you know, in time we'll see those numbers start to decrease. Amazingly, we have only had, since the ban has been put in place, less than 30 complaints and reportings of bars not being in compliance or businesses not being in compliance. So, you know, which was fantastic, and we've gone out to the different venues to look around, and it is very reassuring when you walk through the quarter and you see the smoke-free signs and things posted, and you walk into those venues and there is no smoking. So I think this community was ready for this, and that, you know, it's been really a very smooth transition for the city to do this. So I'm very proud of the city and where we are.
So with the progress the city is making with access to mental health and with the smoking cessation campaign, it says a great deal about what the city feels with this community health and how important community health is to the city of New Orleans.
Yes, not only to the officials in the city of New Orleans. We have taken the approach with the city health department and frankly with almost every city agency that we are going to listen to the public and what they want. You know, for example, in the health department, one of the first things we did when we came in 3 years ago was complete a community health assessment with all of the partners at the table to talk about what was important. What did you think we needed to be focused on? There were some things that we had already started working on because they knew they were important. Childhood obesity being one, violence, which is a major issue for the city, and the public's feeling about that, you know, in terms of how we approach it. It is a public health issue. So we brought those things to the table. We listened to our community and let the community help to drive where we needed to be. So these are the things that we focus on and we put our energies in to make sure that for the people's health, we are doing the right thing. And we are doing the things that they intend, that they want us to do.
And that is so important.
Yes.
When we come back, we'll continue our conversation with Charlotte Parent, Health Director for the City of New Orleans. So don't go away. We'll be right back with more of Community Health Heroes.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
With a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers. The first pitch is fouled between
Jackson. Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
My mother shaped me as an actor, as a musician, as a human being. So when she was diagnosed with colon cancer, it was like our entire family got cancer. And she died when she was only 56, so this is personal. And hopefully my heartbreak is your wake-up call. You can prevent colorectal cancer. If you're 50 or older, get screened. Screening saves lives.
Welcome back to Community Health Heroes. Before the break, we were having a conversation with Charlotte Parent, Health Director for the City of New Orleans, about some health concerns in our city. So, we've got 2 new facilities coming online soon.
Yes, we do.
University Medical Center and the new VA hospital.
Yes.
Tell us when they're going to open and what their opening is going to mean to the city.
Sure. So these are exciting times for the city, and the University Medical Center will be opening, actually taking patients starting August 1st.
Oh, that's wonderful.
They will be moving patients from the old University Center over to the new facility, and a ribbon cutting will be happening during the week of Katrina. The Katrina anniversary for the new center. So that is exciting, and LCMC, who is the operators for that facility, are very excited and planning what to do and how that's going to affect the city. The second facility is the VA facility that's not scheduled to open until sometime in 2016, but again, you know, anyone who's been downtown, it's a big footprint of the city and what it looks like, and really will put us on a cutting edge, you know, with the Bioinnovation Center that's down there,
Sure.
those 2 new facilities, the hospital in New Orleans East, the network that we have of community health centers throughout the city. We are moving well ahead in terms of access to care for citizens. And
It's certainly a
great.
new medical landscape
Yeah,
in New Orleans, and
absolutely.
it's very welcomed.
Yes.
So let's talk about senior health. The latest America's Health Rankings, sadly, had Louisiana at 50th in senior health issues. What is the city doing to try to improve some senior health concerns and to address that issue?
So, you know, the city in particular, the work that we do around access to health care is more in general in terms of access to those community health centers, making sure that as people want to bring new centers on board, that we're a part of having that conversation as to where to put it, because the access piece, you know, people tend to want to clump things into one space. And we really want to encourage those people who want to put services in places maybe that you don't have it. For instance, down in the lower 9th Ward, Baptist Community Health Systems has a clinic down there, but we're recently opening the Sanchez Center, which is, again, rebuilt after Katrina. And in that center, you have a senior center that's there, primary health care, Healthy Start, which is for women and children,
really exciting.
and WIC. And all those things are going to be in that one space, what we call our life course work. And with that being a template for us for the city as we rebuild these different centers, putting those services in one place to better serve seniors and others.
That's fabulous. So give us an update on Fit NOLA.
So Fit NOLA is still going strong. And you know, when we started Fit NOLA 3 years ago, we brought people together to talk about childhood obesity. Thought we would have a small group, ended up with over 200 different partners showing up for that, and it still has those numbers.
That's wonderful.
We're focusing a lot of our work right now on Fit NOLA Business, which we're going around to businesses and talking to them about how to make sure that their businesses are healthy. What are they doing for exercise, for nutrition, things like that. And they register and we score them out as a Fit NOLA business and they get that recognition. We still do a lot of work with NORD around the parks and those sort of things. And Fit NOLA also provides that access for partners who have services that they want to make sure we get out, whether it's yoga class or the Eat Fit NOLA piece and those sort of things. And we're hoping by the end of this month, I think the end of this month, we're going to be introducing an application, a phone app, that will put all those pieces together that
That's
someone can
wonderful.
go there and they'll be able to find what's there, who's in Fit NOLA, and where those...
Because everybody has their phone, don't
they?
they?
Hit a phone, yeah.
That's
so
great.
we are very excited about that. And like I said, we should be seeing that towards the end of July, beginning of August.
Great.
Yeah.
So let's talk about the homeless in New Orleans. How is the city approaching the problem of the homeless in New Orleans?
Sure. So the good news is that the number of homeless in the city has seen a rapid decrease since Katrina, after Katrina, and not just because we don't have a number of homeless. The partners have worked hand in hand to make sure that the homeless within the city can be housed and put in housing, and we work this, and I'm not kidding, every week. Outreach is out there identifying the homeless and where they are, trying to get them what they need so that we can get them placed in housing. We are down to now the most difficult people to house.
Sure.
And so while we are trying to work through that and get that last piece handled, we're looking at other opportunities, whether it's a low barrier shelter for people to move the issue for us, which is the public health issue of the numbers of people who stay under the expressway. And we have people who will come and they bring food out there, don't clean it up, and then you draw rats and all kinds of things. And so we spend a lot of time just trying to clean that up. And so our goal is to get people housed. And we are working with the partners to make sure that happens. The Downtown Development District is involved. Just a bunch of people who see this not only as a serious problem from the business standpoint of what you have, but from the human problem of not having people housed.
Sure.
So there's been great work around that. Veterans homelessness is basically what we considered in our community now at zero, functional zero, meaning they've been housed in place. And we're going to take some of those lessons learned and use that for the rest of the homeless that's out there.
Thank you so much, Charlotte. This has been really great information to share with our viewers.
You're very welcome. Thanks for having me.
Absolutely. When we return, we'll be in the kitchen with Phil Degree of Phil's Grill for another Eat Fit NOLA cooking segment. So don't go away. There's more on Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 50 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu. We make it easy for you to dine at your favorite New Orleans restaurants, guilt-free. Every month, the Community Health Heroes Show shines a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining in their restaurant or any of our other great Eat Fit NOLA restaurants. So don't go away, Community Health Heroes will be right back with our Eat Fit NOLA cooking segment.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Welcome back. Joining us today for Eat Fit NOLA's cooking segment is Phil Degree of Phil's Grill, who's going to prepare a healthy version of America's favorite sandwich, the hamburger. Thank you for joining us today, Phil.
Thanks
so
for
what
having
kind
me.
of burgers did you bring with you?
So today I brought a bison burger and a veggie burger. And we're going to top the veggie burger with a little portobello mushroom.
Fabulous. Now, compared to a regular burger, what would be the caloric intake of these?
These are both the preset Eat Fit NOLA burgers. Both of these are about 450 calories.
Awesome.
A little bit less for one, a little bit more.
So when we're doing our burgers for the holiday, what's the best bun option? Be healthy.
Well, a true whole wheat bun, which we had to do a lot of work. We have a local bakery, Cortez's Bakery, that makes our buns for us. And,
awesome.
We used to have a whole wheat bun. It wasn't, used some white wheat in it. And so we've done a lot of research and worked with Molly's team to get our Eat Fit NOLA items down.
So it's a restaurant, what other items do you have that are Eat Fit NOLA certified?
We have 4 pre-built burgers. So at Phil's Grill, it is build your own, but with the Eat Fit items, we made some preset burgers so that it's easier for people to come in, they want to order a healthy burger, they're not overwhelmed by how many options there truly are. So we have 4 preset burgers that are on the menu all the time. We have a bison, a veggie, a grilled chicken, and a tuna.
Oh, it smells fabulous. Let's talk about toppings. What are some of the healthier toppings and condiments?
So with this bison burger, we do a homemade chimichurri sauce, which is really just fresh herbs and lemon juice. And we top it, we cook it on the char grill, top it. Some tips for grilling at home, you want to keep away from flare-ups that can char the meat, because those have the carcinogens that cause cancer. I was just recently diagnosed with stage 3 colon cancer, so I'm learning a lot about that. So you want to watch for that. You want to watch meats that have added nitrates in it, which none of ours do. So even our regular Angus, which isn't on Eat Fit NOLA, but it doesn't have added nitrates to it. So.
Well, it smells fabulous. If somebody wants to check out your restaurant, Phil's Grill, where is it?
I have 2 locations, 2 full-service locations, and they're one's on Severn in Metairie across from Lakeside Mall, and the other, this is the bison, and the other is on Hickory in Harahan. And then I have Little Phil's, named after my son, and that is in the Place St. Charles food court downtown.
Awesome. I've noticed you didn't use any condiments like mayonnaise.
No, that wouldn't be healthy, would it?
No, it would not.
I used the chimichurri sauce on the bison, which, by the way, I eat this one quite a bit. It is so good. It really is. Bison has a rich beef flavor to it. It's not gamey at all. And then we used a balsamic vinaigrette that we make in-house for the veggie.
Well, I wish you all could smell this. It actually smells divine.
Yeah, you can eat healthy. We're the only burger joint, and there's a bunch of them nowadays. We're the only burger joint around that you can actually eat healthy at. I don't know how much you want to do that. But this, really this bison, Eat Fit NOLA bison, it tastes like you're not eating healthy.
Well, in Louisiana, being that we are ranked one of the unhealthiest states with our obesity, this is exactly what we're looking for, exactly what we want to offer people. So thank you for joining us, and this looks delicious.
Thanks for having me.
Absolutely. Join us next time for another segment of Eat Fit NOLA Cooking. Don't go away. We'll be right back with more Community Health Heroes.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line. I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
I'm Bill Reed, Director of NOAA's National Hurricane Center in Miami. Surviving a hurricane all comes down to planning well before a storm arrives. Have a hurricane plan in place, know the types of hazards that could affect your family, and know your home's vulnerability to storm surge, flooding, and wind. Find out if you're in an evacuation zone and have an escape route plan. Assemble a disaster supply kit, have enough water, non-perishable food, medication to last at least a week. When a watch is issued, the onset of tropical storm force winds are possible within 48 hours. Check your disaster supply kit to make sure nothing is missing. Activate your hurricane plan. You may need the extra time to secure your boat. A warning means the onset of tropical storm force winds is expected within 36 hours. Be ready to use your disaster supply kit and take it with you if told to evacuate. Close up storm shutters and remain in a safe place throughout the storm. When the storm is over, don't be a sightseer. If you do venture outdoors, watch out for flooded roads and downed power lines. Wait until an area is declared safe before entering. Be prepared this hurricane season. For more information, visit our website at hurricanes.gov.
Thank you so much for joining us today. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Ann Kayla Garbo. Join us next time on Community Health Heroes.